I think it really hit home when it was officially declared a pandemic by the World Health Organization. And at that time, it was just uncertainty, the best way to describe it. We didn't know what to expect. There was so little information, and the information we did have was changing at a rate of almost daily.
After we stabilized somebody, all my staff were in one room, and I was like, well, I better go check the rest of them. There was one gentleman that had been on the ventilator for about a week already. I realized that his medication had stopped that was supporting his blood pressure, and he was on quite a bit of it. There was one other person next door, and I was like, well, I better just check on her and make sure she's okay. And whenever I looked, her oxygen had come off, and her oxygen was in the 30s. Now I'm the person that has to decide 2 different people's lives. What am I gonna do? That's when it really hit me. That something else was going on, something more.
We went from just normal, everyday ER business to, hey, we're not sure what's going on in the rest of the country, but we've got to figure out what happens when it comes here to Amarillo. But then once we had our first patient, it just seemed like we had a million COVID patients all of a sudden, and we didn't have enough resources, enough beds, enough rooms. What is this? What just happened, and what do we do?
Every day was more and more isolation rooms. We started running out of ventilators. Just the hospital looked different with no visitors, all these nurses and respiratory therapists that we didn't know that were coming in to help us.
What made it most real to me was our very first patient. And we went up, we had the whole senior team go up to tell this patient, you were number 1 based on our testing. He was coughing, looked fine, and I said, well, probably you're gonna shake this off and go home. And the next morning, he coded, had a cardiorespiratory arrest, ended up in the ICU for 2 months. And I think that's when it all made us realize this virus is different.
I had just come back from maternity leave, so I had a newborn at home. None of us knew what this was or what was gonna happen, and could I take it home to my newborn? So I think my biggest emotion was, how do I protect myself and my family, but also how are we protecting our coworkers and making sure that our patients are getting what they needed.
One of the things I remember is every morning going to work and seeing the buses out front. Started with like 2 buses filled with travelers that were in our hospital, and then I think by the end of it there were 6 buses out front. Every room being filled with patients on ventilators, and we're having to turn them on their bellies to help get their oxygen up. It would take probably about 5 to 6 or more people just to get them ready and get them turned into the proper position.
And then just the sadness, around the world, so many people were dying, and we didn't know why or how to fix it or how to treat it.
And during that time, it was a little difficult for me to sleep because I could see all of them whenever I would go to bed. I'd see their faces as they're begging me to save them and holding their hands, talking to their families, to try to reassure them as best I could that we were doing all that we could to help them. Seeing so much death happen, none of us were really prepared for all of that, and new nurses that come in and all they know is people dying.
We had one elderly couple that both of them had COVID. And essentially we knew that both of them were on their deathbeds. And our MICU staff actually got a special approval from the administration to move their beds into the same room. And so side by side was the elderly couple holding hands as they both died within hours of each other. And that was an incredible event. And then we had another young lady who was very sick and again knew that she was gonna pass and wanted to marry her longtime boyfriend before she died. And so our MICU staff essentially organized an entire wedding for her. And so our charge nurse was the maid of honor, they had flowers, and then our chaplain actually did the ceremony, and basically she wed her longtime boyfriend, and then she passed the next day. These were the kind of just stories of humanity that we saw, frequently in the hospital. It just, still gives me goosebumps when I think about it.
One of our patients, her oxygen was not doing good, and we were on our last leg of trying to help her, and we really needed to put her on the ventilator because she just was not going to be able to keep up, and she was so adamant about not. I sat beside her and told her to just tell me what she's feeling and what her thoughts are, and I remember telling her that for us to do everything, this is the next thing we need to do. And she looked me in the eye and said, I want you to be truthful to me, and if you're going to really help me as best you can, because I matter. And I remember having to take a real big gulp at that point, because I knew she did. But when you finally hear somebody say that, it hits you a little different. We tried our best to have some kind of positive things going on. We'd all hang around the nurse's station where all my snacks were, and we'd talk about what's going on and try to keep things try to revert us back to some normalcy as best we could. And there was definitely a sense of camaraderie amongst everybody. We all had each other's backs because we were what we had.
As nurses, we don't ever define ourselves as heroes, you know what I mean? It was our calling. I mean, you become a nurse for a reason, and I think that every nurse would say that, you know, we do this because we love it and we love our patients and we want to make a difference. But we don't want to make a difference because we want to be a hero.
I was just doing my job and doing what I like to do. It was a calling just to be there to help those patients and be there when they needed me. But I don't feel like a hero.
In many ways, we rebuilt that hospital multiple times. It's almost like rebuilding an airplane in flight. You know, suddenly we find out that, oh my gosh, you know, they have to be in isolation rooms. And so our physical plant engineering guys would get in there and reroute all the airflow and all the stuff to try to accommodate that. The next day it was like, nope, we have to build these kind of rooms. And when I think about just the efforts our staff went to just alter that hospital physically to try to accommodate the needs of these patients and keep our staff safe, it was mind-boggling.
The physicians, the first responders, EMS, everybody in the hospital, really, we were all there, all being exposed to the same thing, just doing a different job. Housekeepers still showed up every day, dietary, same thing with first responders, law enforcement and EMS, fire. They all had the same risk, but we all showed up and did our jobs every day.
People sometimes do forget that it is important to say thank you. We got a lot of thank yous and support in the beginning of COVID, and now, you know, sometimes people forget how much we've done and what we've been through and what we've seen, that it is important to thank your caregiver, your nurse, your respiratory therapist, and just let them know that you appreciate them and you thank them for what they do.
Mother Nature is always going to throw a curveball at us. And so you think about the great flu in the early 1900s, and then polio in the 1950s, and then HIV, and now COVID. What we have to learn is we need to maintain our memory a little bit better. Okay, we go through these massive epidemics or pandemics, we learn these lessons, and then they fade. And if on average it takes about 40 years in between each pandemic, hey, how do we maintain that readiness and know it's going to happen again? And how do we stay focused and not start splintering and saying, yes, we have our individual interests, but in this case, humanity's got to be one.